Good morning. Is it popping up or just voila? Well, again, thank you all, and I want to thank Ms. Spence particularly for inviting me to come. I'm kind of in the same boat. I'm going to talk really fast. I got a lot of information on the slides and really just want you all to be able to see them, and hopefully afterwards you can definitely take an opportunity to go back and reflect. I was asked to talk about the life course theory and really poverty and how it impacts infant mortality. And what I want to start out with is to really look at what life course theory is about. Now, in some cases, many people say it's not necessarily a theory. There's not a lot of empirical data that really supports the fact that makes it a theory, and that's when you get all into that whole philosophical standpoint. But for many of us, we refer to it as a theory, and a lot of places we talk about it as an approach. I thought that this particular statement from Frederick Douglass really kind of talked about and can set the stage in regards to where we are when we talk about life course. In thinking of America, I sometimes find myself admiring her bright blue skies, her grand old woods, her fertile fields, her beautiful rivers, her mighty lakes and star-crowned mountains. But my rapture is soon checked, and my joy is soon turned to mourning when I remember that all is cursed with the infernal actions of slaveholding, robbery, and wrong. When I remember that with the waters of her noblest rivers, the tears of my brethren are borne to the ocean, disregarded and forgotten, and that her moist, fertile fields drink daily of the warm blood of my outraged sisters, I feel with the unuttering loathing. And so when we talk about looking at life course approach, here are just some examples and really some nuances in regards to that. And I'm just going to quickly kind of go through some of the slides to kind of give you an idea. When we look at slavery and what slavery has meant to us as African Americans, and not only African Americans, but America as a whole, and we really begin to see how do you overcome such an institution of the things that people were subjective to during that time. So one big piece and part of this approach is looking at the social historical aspect, the event itself. We see war-torn countries, we see the violence that we see in our communities. All of these things help impact who we are today. And it goes from generation to generation. And as we're looking at that, it moves on, and I'm just again going to go quickly, looking at the timing of our lives. So if we find ourselves in an experience when you see a bunch of killing and murders and gang violence in communities, and you are a child and you are actually born and bred in that environment, in the long run, you ask yourself, what kind of impact does that have on you? Very similar to talking about the corrections, as you mentioned earlier, Your Honor, in regards to how this forms a way of being and how do you overcome some of those issues. And so when we look at timings of lives, they break it down into three major categories as far as the individual, which really is when we talk about from infancy, going into adolescence, going into young adulthood. Also, they look at based on the generation. And so here, again, we have seen a lot of changes over the years where we had grandparents living very closely to parents and to their grandchildren, which did give a lot of influence in regards to how our particular families were reared and how they grew up. One of the big pieces that we see, especially when it comes to infant mortality, as we talk about changing a tradition and changing a position, when we talk about safe sleep practices in regards to how grandmothers influence moms on how they raise their children and how they put their babies sleep in a sleep position. We tease a whole lot when grandparents, grandmothers specifically, are present in influencing how a baby sleeps versus on their stomachs or on their backs. This is all kind of a generational thing that we have to look at as we begin to really go out and do outreach and try to improve some of our infant mortality rates. And then also we look at history and what impact history has on a certain population. Then we also move into our next phase when it comes to life courses is, again, using an example that shows here, is that when you have weak family ties, if you are definitely looking at you have a young person who relies on and should rely on their parents, just like he mentioned earlier, and they're not there, or they have difficult economic times that they can't provide the kind of support they would like to give to their child. This also impacts how we see people matriculate throughout life. The other thing is the link in social ties, which is some of the stressful events that people deal with. If you live in poverty, if you live in a very violent society, a violent neighborhood, one of the recommendations we tell women in regards to looking at helping to improve birth outcome is to go out and exercise, go for a walk, eat healthy. Well, if you live in a community that going for a walk is going to cause you more stress because of the violence, how can we get them to do that? If you tell them to eat healthy and you live in a community where there's not any grocery stores that have fresh food, how can you do that? So again, we're looking at a lot of issues that we see in regards to just how we link lives, as well as our own personal control. And however, as you see here, we recognize the ability to make specific choices depending on our opportunities and constraints. Parallel is this idea, the concept of control cycles, whereby families and individuals modify their expectations and behavior in responses to their changes in either their needs and their resources. So we all have our dreams. I remember, again, doing a TV spot, and a young woman who came into our clinic was talking about African American mothers and teenage pregnancies. And she made some sort of statement in regards to when African American moms bring their babies in, bring their daughters in and discover if they're pregnant, what kind of feelings they have about that. And she was very cavalier to say, well, you know, it's just kind of one of those things. And I had to correct her and let her know that there's no African American mother that I have seen that brought their teenage daughter in and was pregnant, found out she was pregnant, that she was happy about that. And there's a lot of perceptions that we accept that, and that's not the case. We had a lot of mothers who talked to their daughters when they found out they were pregnant, very upset, saying, what, you see how I had to struggle? You see what I had to go through? I worked extra hard, be it that she was a prostitute or whatever the situation was. She did what she had to do to try to make sure that her daughter would not fall that same path. So again, there's a lot of perceptions in regards to that, and that, again, that is all part of that life course approach that we're referring to. And the other big is that, again, how your past shapes your future. And that is for all of us. We operate on what we were taught, what we saw, what we experienced. And so if you're living in an environment that everything that you see is negative, all of the things that you see on TV, we worked a lot with foster kids who were adopted by African American children who were adopted by white parents, who were really loving and very, very, very supportive. And what we saw is that in the early part of their life, living in that environment, it was really, really good. But by the time they got about 13, 14 years old, we saw a shift. There were some issues that started coming into play. Well, one of the major things is that these young adolescents, African Americans, began to see the media messages, began to see how people perceive them in these communities. And so in their mind is, I'm black, so I must be bad. So again, it was that concept, no matter what kind of environment they were raised in, because of what all of the outside factors had really said, this is what you're going to end up being, there was a struggle for them to understand that they could rise above that. Again, I'm not going to read that, but I just thought I wanted to give you again another piece here. And it's amazing because I love history. And we look at Frederick Douglass, who wrote these speeches so many years ago. And even though he wrote them, just look how true they are today. And again, it gives us an idea about that life course piece. How do you overcome that? That if we can still stand here today and be able to say that some of the problems that existed, if not all, during slavery, can still apply to what we are saying today. One of the big pieces that we see are social determinants of health. And I know throughout the day you will hear some more information in regards to these. But this is one of the major factors that we see that can contribute to poor birth outcome. How do you overcome a lot of these things that we work hard to address? I'm from Ohio. The governor in Ohio has put in about $26.4 million to provide funding to community-based organizations to overcome the state infant mortality rate, which is pretty bad. And even with all the money that he's put in, we found out with our new statistics, the rates had even gotten worse. So the question is that, well, what's happening? We're putting all this money in, we're providing money to community-based organizations, we're doing this and we're doing that, and why are the rates not improving? And so I do a lot of work with public health nurses, and everybody kind of has that elephant on the table about, well, it's just the people. No matter what we put in, no matter what kind of programs we do, they just don't want to do any better. And so I said to them, I said, you have to recognize that you are putting a Band-Aid on a multitude of issues. And how do you overcome that? Well, my number one claim to fame, that it's very important to be able to bring the community together. We wanted to just kind of give a little bit about poverty and what the impact of poverty has. And here I'm defining poverty for many who do not know, and know it's not a state of mind, as we heard earlier this few weeks ago that somebody said. There's a lot of consequences when it comes to poverty. And during pregnancy, we see mothers face a multitude of stress in their life. We know that early childhood consequences in pregnancy can be multiple and often set a newborn child on a lifelong course of disparity of health. We also know that poverty has consistently been found to be a powerful determinant in delayed cognitive development and poor school performance. And we also know that there's sound evidence in support of policies and programs that can reduce the disparities among poor, including the role of the health professionals, health practitioners. And there's probably because there are many interventions and programs targeted poor that are not properly evaluated and critically appraised. And so a lot of times we do just kind of put a Band-Aid on some things because it's such a huge and overwhelming task. There's a lot of things here that we show in regards to poverty, and again, these are just some of the lists that we know as a result of women living in poverty and also babies being born in poverty. What I want to do and end with right now is that even through all of the things I've talked to very quickly, I apologize, I want you to leave you with one particular thing, the impact that the community has to make a difference in helping to address some of the things that we will be talking about today. I always talk about in these kind of settings, in many instances, we are preaching to the choir. How many people here, if you could raise your hands, are lay people from the community who does not work in infant mortality law? Could you raise your hand? Okay. These are our keys, and we really need more people from the community to be at these type of events. Again, this is another historical event. Back in the 1920s, when African American women couldn't go to the hospital to deliver their babies, when doctors wouldn't go into their homes, into the communities where they would help deliver babies. Not only white doctors, but black doctors wouldn't go either because folks couldn't pay. So here you saw the granny midwife. How many people are familiar with granny midwives? A few. And so here is another opportunity to show how we as a community began to heal our own ills and been able to provide that type of services. What can be done? There are many initiatives do not embody community voices, support participation that is necessary for sustainable long term. It is necessary for future approaches to involve minority communities to reduce the rate. Don't give me a fish, teach me how to fish. Teach people, empower people, and educate and engage communities on being able to make a difference. It is so very important. We did a series of community health forums in the state of Ohio, basically addressing these issues. We basically charge the community to go out and help tackle some of them. We provide many grants to them to be able to go out and to reach other people. We felt that it took a village to basically save a baby. Not only does it take a village to raise one, but we knew that it was important that they would go out and empower them and help them to understand the impact of infant mortality. And so with that, we just based it on the theory of change. We basically used our community as change agents. And so as I close, I just want to give you some examples of some of the activities that we're doing across the country in regards to how we can make a difference, bringing communities together. We basically, on Saturday mornings once a month in Detroit, we give away free pack and plays. We educate the community, a lot of young mothers who come in, and what we do is we train them as safe sleep advocates. And basically we give them certificates. At the end of the day, we say to them, now we have charged you for delivering that message in your community. Here's another example of all of the fraternities, all 5 of them, which has started an organization called Brothers United, who are now promoting breastfeeding and safe sleep. So we got a little competition going on now. It started out in Arkansas, and now we're just starting our new Ohio chapter. Here is Kappa Alpha Psi fraternity along with their spouses. Here again in Columbus. And here is the Ohio chapter of Brothers United, who just started there in Columbus a couple of weeks ago. And so here is the national pole mark and president for Kappa Alpha Psi, who has been giving out cribs across the country. They're targeting teen dads. We know that dads who, the problem is, we talk about safe sleep, in a lot of cases, fathers don't have cribs. So if they're non-custodial dads and the babies go visit to them, where does the baby sleep? So we are looking at providing cribs to non-custodial fathers to be able for them to have a safe place to sleep when their babies are. And again, this is some of the work we're doing in Michigan. So with that, thank you very much. I'm sorry for talking so fast and skipping around. Okay, thank you.